All right, welcome everyone. Thank you very much for joining us for tonight's 2023 Healthcare is a Human Right December General Meeting. Tonight we have a really great program for everyone. To convene the meeting first, I want to introduce Sybill Hyppolite. Sybill is the Government Affairs Director of the Washington State Labor Council. And she is going to do the convening and the land acknowledgement. Take it away, Sybill. Thanks for joining us.
Okay, hi everyone. I'm here with Day, my baby or toddler. And as Nathan said, my name is Sybill Hyppolite. I'm with the Washington State Labor Council. My pronouns are she and her. And I'm happy to be here with you all to join together and reaffirm our shared goals for healthcare justice in our state and our country. I want to take a brief moment to acknowledge the land that we are on and the peoples who have stewarded it since time immemorial. I want to honor with gratitude their ancestors and the generations to come. I also mention that my own history includes forced labor and stolen land in the land of the Arawak and Taino in Haiti, which was actually the point of first contact with Christopher Columbus. Just wanted to acknowledge my own history and invite everyone in the space to explore your own history of colonization and also Indigenous sovereignty, Black liberation, and all of the great things. So really appreciate the opportunity to be here and acknowledge this with you all tonight.
Thank you so much, Sybill. Great to see Ade as well. All right, now I am going to introduce our wonderful MCs for the evening. First, we have Gina Owens. Gina Owens is on the Healthcare is a Human Right Steering Committee. She is on the Organizing Committee. She is a tireless healthcare and housing advocate. She is a Washington Community Action Network board member and a Real Change News vendor. So thank you very much for being one of our MCs tonight. Cheryl Wapasia Mays is our co-MC. She is also a Healthcare is a Human Right Steering Committee member and Organizing Committee member, as well as being a board member of the Washington chapter of National Organization for Women, an educator at the Puyallup Tribe's Chief Leschi School, and an enrolled member of the Assiniboine and Sioux Tribe of Northeast Montana. Thank you very much, Cheryl, as well. And Gina and Cheryl, take it away.
All of us in this room today, because we share a passion that stems from lived experiences around what our healthcare system has been for us to date. So for those of you who are new to Healthcare as a Human Right, fondly known as HCHR, we'll take a few moments today to give you a quick look at our coalition and some of our most recent work. HCHR is a grassroots community/labor campaign formed in 2013 to secure the fundamental right to health care for all individuals in Washington State and our nation. We're an important part of a growing movement for health justice. We have and we continue to win important victories along the way. As a coalition, we can grow stronger in numbers as we advance each win towards universal, affordable, equitable health care for all in Washington and beyond.
All right, thank you. Tonight we're going to be highlighting victories on safe staffing, reproductive rights, health equity for immigrants, and the fight to protect Medicare. We'll also have a budget report, and then we're going to go over our 2024 policy agenda and vote on it. And finally, we're going to have a call to action on the Keep Our Care Act. Thank you, everyone, for being with us tonight.
Hear about some of the highlights of our coalition's work this year. We want to welcome the newest member to our organization, Real Change News. They're the newest sponsoring member, and we have with us tonight the voting representative, Camille Gick. So thank you, Real Change. Cheryl, are you up yet?
As per our evening's agenda, tonight we'll be highlighting victories on safe staffing, reproductive rights, health equity for immigrants, and the fight to protect Medicare. We'll have a budget report, and then we'll go over our 2024 policy agenda and vote on it. Finally, we'll have a call to action on the Keep Our Care Act. Thank you for being with us tonight. I am also pleased to introduce Mo Brinkland as our timekeeper, and she will give a warning at 1 minute to go for all speakers, which she will now demonstrate.
1 minute.
Now we will hear about a few successful and ongoing campaigns led by some of our members. First, we're very pleased to welcome Tom Lambro, Political and Legislative Director of United Food and Commercial Workers, 3000, and President, MLK Labor Council. He will tell us about a victory on safe hospital staffing that took 10 years and is not the end of the story.
Well, thank you, Cheryl. It's nice to see everyone. Good evening. Thank you to all the organizers from Healthcare for Human Rights Coalition for inviting me / us. We were the Washington Safe and Healthy Coalition, just to discuss the landmark achievement in the health sector in our state. This is the passage of safe staffing laws, Senate Bill 5236, passed by the legislature earlier this year. That law represents a decade-long journey filled with challenges. We had unprecedented community engagement, and ultimately it was a testament to the power of persistence and collaboration by many, probably here on this call, and certainly by the members of the folks in that coalition. So for over 10 years, the goal of the coalition has been clear, which is to ensure that we had safe staffing levels in our hospitals. It's a critical factor in both patient care and worker well-being. Despite that commitment, the path was fraught with obstacles, and we tried to win the battle through bargaining with hospital employers, but our efforts were really met with pretty stiff resistance. The hospital industry, probably no surprise to anybody here, equipped with substantial resources, opposed us at every single turn. Their clout, however, was not enough to outweigh the righteousness of our cause. What truly set this journey apart was the unprecedented level of community and membership engagement. That was not just a policy change; it became a movement fueled by the voices of those who care the most, our members, patients, and their families. Our success is largely owed to the solidarity and the close cooperation with other healthcare unions, including SEIU 1199 Northwest and the Washington State Nurses Association. By uniting those efforts, we amplified our voice and we strengthened our position. The turning point in our journey came with a crucial compromise earlier this year, recognizing the complexities and the varying needs of different hospitals. We agreed to a solution that ensures members are equal partners in hospital staffing committees. It's a huge step forward in giving workers a say in their work and conditions. It was not everything that we wanted, of course, as every compromise is, but it was a big step forward for us, and we felt good about it, and we avoided a costly initiative campaign on the ballot this next year. So the law is not just a victory, a legislative victory, but it's also just a win for every hospital staff member and patient who uses our hospitals in Washington State. So in conclusion, the passage of the law was a testament to what can be achieved when we stand united for a common cause. It's just the beginning. We know we have a lot of work to do to continue to make sure that the law is being implemented well, and that it lives up to the promise that it ultimately was supposed to fulfill, which is to create a safer, more equitable healthcare system in Washington State. So thank you to everyone here for helping do that in your own way. And I really appreciate folks' time. And thank you again for inviting me to come and participate with you all this evening.
Tom, you're a pro. Thank you. Next up, in 2023, we prioritized the fight for reproductive rights. Here to talk about what we won and what lies ahead is the awesome Sarah Dixit, Pro-Choice Washington Organizing Director. Sarah, take it away.
Thank you, Gina. Hi, everyone. My name is Sarah Dixit. My pronouns are she, her. I'm wearing this little bandana, if you can't see me, with a sweatshirt that is navy blue that says abortion is normal, the small little Christmas tree behind me. And I've been the organizing director for Pro-Choice Washington for about 6 months now. And before that, I was at the Planned Parenthood affiliate out here in Spokane. So I'm part of the East Side cohort. But thank you for having me in this space. So for some of you, this might be review. For others, this might be new information. So if you have any questions, feel free to throw them in the chat. I'll also provide my email at the end. So if you have questions that come up later, you can email me. Last session, so earlier this year, was the first session post Dobbs, which was a decision that took away the right for someone to have an abortion at the federal level. So it went down to the states. So a lot of organizations, Pro-Choice Washington included, were really much paying attention at the local and state levels to see what we could do. So this was the slate that we had earlier this year. And you can see that it was overwhelmingly a very successful session. So we're going to walk through some of these on some of these slides. Awesome. So John is going to be leading something about COCA later this meeting. So I will run through this a little briefly. But essentially, the Keep Our Care Act would give the Attorney General's office oversight and enforcement power to ensure that healthcare systems can't merge without any oversight. Because what we're seeing is that kind of just happens and people don't know about it until well after. And we know we can't unmerge a system once it's been merged. It's pretty rare that that happens. So this is a big issue, but like Tom said right before me, the hospital has a lot of money. So it's been quite the challenge over the past few years to get COCA moving. But, you know, we just keep trying. So this past session, it died in Senate rules. So thankfully, with a short session coming up, we can start from that point. So we're really trying to hit the ground running starting in January. So some history. So this will be year 1, 2, 3, 4 of trying to get COCA passed, and I'm sure much longer for when the policy was being created and all that stuff. So definitely a multi-year campaign, similar to mandatory comprehensive sex ed for those of you who were part of that fight. And then again with referendum 90, this is a similar thing where we just have to keep on it. And I know for a lot of people, it might seem like redundant or like annoying to talk about this again, which we totally hear you. We also want to be able to say that we passed it and not have to continually tell people to advocate for this issue. But yes, we're really focusing on expanding movement partners and encouraging lawmakers to be bold about this, because some people have been a little wishy-washy. So just trying to show that we need to pass this as soon as possible, because the issue is that COCA can only be a stopgap solution, because it can stop if the metaphor is that Washington State's healthcare systems are bleeding out. COCA would stop the bleeding, but it doesn't fix the wound, because we can't like undo mergers and like loss of care once it's happened. So the sooner we pass this, the better. Next slide, please. Awesome. So for some wins, we passed HB 1115, which was ending cost sharing for abortion care. So like when you use your insurance and you go to a clinic to get care, any type of care, you sometimes have a copay or there's a portion that your insurance doesn't cover. And sometimes that is a mystery amount, right? Healthcare providers don't just list their stuff like a menu. You can't be like, okay, based on my budget, I can get this amount of healthcare. You kind of just like slap with the bill at the end. So what's helpful for this bill was that it requires insurance companies to cover 100% of the cost. So patients aren't hit with a surprise bill at the end of their visit. Next slide. The SHIELD law, super important as we're looking at what's happening nationwide all the time. When it comes to SHIELD law, especially here in Spokane, it's super important, right? So we have patients coming from Idaho all the time, and we know that Idaho right now, the abortion trafficking bill that became law is held up in the courts, but it's really questioning that interstate travel and how people can get care. So this one really shields patients and providers, because we know sometimes a state will be like, fine, we'll be nice to patients, but providers were coming for you. So really trying to protect both in that. Next slide. This should be my last one. Okay, great. So this is another big important one that goes in conjunction with the SHIELD law. So this one ensures that Washington provider licenses are protected from negative action for services that are legally protected here, even if criminalized in other states. So if you're providing gender affirming care, abortion care, you should be able to do that in a state that's legal and not feel like you're at risk if you are from Idaho or you live in Idaho or you have different licenses elsewhere, because we know a lot of people are licensed in multiple states. The end.
Thank you, Sarah. That was very informative. So Washington was one of the first states to offer health care coverage to all undocumented children. Now, we are the first state to win coverage for undocumented adults. Here to tell us about it are Joseph Lachman, Policy Manager, Asian Counseling and Referral Service, Li Chi Leong, Senior Policy Advocate with Northwest Health Law Advocates, presenting at the invitation of ACRS.
Thank you. And thanks to all of you for your support, and to ACRS for inviting me to share an update about our victories this spring. The pandemic demonstrated we need to fight for a future where all Washingtonians can access the healthcare we need. A coalition of immigrant-led organizations, providers, and allied organizations have worked together in recent years to improve access to affordable coverage for everyone in Washington, prioritizing equal access for those who are uninsured and underinsured due to immigration status restrictions. While Washington had been a leader in health coverage, federal restrictions and state austerity cuts left many immigrants without access to critical medical services in more recent years. But thanks to the advocacy of the Health Equity for Immigrants campaign and over 100 partner organizations, the 2023 operating budget included funds for the Health Benefit Exchange to launch state subsidies for people who are ineligible for federal assistance on our state exchange. Today, undocumented immigrants can get up to $250 a month in premium assistance for coverage starting in January 2024. The budget also included capped funding for the Healthcare Authority to launch a Medicaid-like program for undocumented immigrants. As you can see on the slide on the left-hand side under the timeline. So these are significant steps forward, but the funds for the Apple Health Medicaid-like program will only cover a fraction of those who are eligible. Meeting the basic healthcare needs for all Washingtonians will make our communities healthier and our state more equitable, but we've got a lot more work to do. To speak to that work, I'm going to hand things over to Joseph.
Thank you so much, Leachy. Again, my name is Joseph Lachman, he and his pronouns, and Policy Manager at Asian Counseling Referral Service. and middle school, high school classmate to David Loud's sons. So just very quickly going over some of the asks that we've come up with from our coalition work. So the Health Equity for Immigrants campaign as a group has come together to talk about what we'd like to see in the upcoming legislative session. The first major priority is making sure that there's additional programmatic funding. Again, considering that looking at the decision package, the state agencies lowered the estimate of how many folks they could cover down to only 10,000. When really we want to see that number be more like 20, 25,000 folks who are getting covered. So right now it's difficult to say exactly how much that costs. But we're thinking of the range that we gone in started talking about $30 million, but we really it's going to cost a lot more than that if we want to get to covering 25,000 folks. So again, just sufficient programmatic funding cover the number of folks, a major proportion of the folks who actually are eligible for this program. We'd also like to see a significant investment in community-based organizations as trusted messengers who help get the word out and get folks signed up for the program, talking about around $3 million to make sure that we're actually integrating the expertise and services of our immigrant-led community groups. Also noting that the Healthcare Authority Health Benefit Exchange in our conversations with them says that they don't feel like they can have a working kind of wait list, like a proper wait list set up until a year after the program launches. So what we'd like to see is funding to make sure that there's both a short and long-term solution to making sure that the data is captured and that folks aren't missing out on their opportunity to get their application in and get their name down so that they don't have to do this again. So making sure that either way, even if we end up with an actual waitlist a year out, that there is a short-term solution in the meantime, so that we're not missing out on these folks who are going to be applying, and many folks who are going to get denied, unfortunately, because of the funding limitations. And lastly, we do feel there's a need for $100,000 for a healthcare authority report to the legislature that puts together a full plan for covering all folks who are eligible and expected to enroll in the Medicaid Lite program for the 2025 to 2027 biennium. Plan really for full coverage. And also Health Benefit Exchange study, just exploring how to resolve the remaining exchange affordability gaps.
I think Joseph did a great job. We're really looking forward to getting more support from the legislature so more people can be covered. I put in chat that the Office of Financial Management estimates 35,000 Washingtonians are eligible for the Medicaid-like program. So there are going to be a lot of people who are eligible for coverage who under current budgetary allotments won't be able to access the coverage that they should be entitled to.
Thank you, everyone, for your time here.
Lichi and Joseph, thank you so much. Those were great presentations. Our North Star for health justice in America is expanded and improved Medicare for all. Here to tell us about the fight to protect Medicare from total privatization by corporate raiders are Lori Wiedner, Executive Director, Retired Public Employee Council of Washington, and Jeff Johnson, Co-President, Puget Sound Advocates for Retirement Action, and former President, Washington State Labor Council, and founding chair of Healthcare is a Human Right. So kick it off, guys.
Thank you so much. Good evening, everyone. It's so nice to see so many RPEC members joining us this evening, including our president, Claire Olivers, and our representative, Gwen Wrench. I have the privilege of chairing the Public Employees Benefits Board Stakeholders Medicare Coalition on behalf of RPEC. This organization formed in 2022 with the goal of increasing accountability for Washington's healthcare authority. We also aim to preserve traditional Medicare and to expand healthcare choice. We stand for healthcare affordability and are fighting to ensure quality healthcare options in Washington for all of our retirees. The coalition had many victories in the fall of 2022 and throughout the 2023 legislative session. We help to transform the healthcare authorities' work with our stakeholder group. Through the implementation of listening sessions, we've increased the agency's accountability to the legislature, and our efforts have brought about significant changes in how this state agency serves retirees during open enrollment. Our efforts earned the top award from the Washington State Labor Council, the Mother Jones Award. We earned this award for our legislative victories and our success in organizing during the 2023 legislative session. The award is given to an individual or a group that embodies the spirit of Mother Jones, who is the founder of the modern labor movement. In terms of our goals for 2024, we are working on a proviso that will increase the Medicare explicit subsidy for retirees who earn their benefits from the Public Employees Benefits Board. All of the healthcare plans that are managed by PEB will see increases in 2024, and one plan in particular will see an increase of 26%. The explicit subsidy is currently 50% of the monthly premium, not to exceed $183 per month, and so we're working to increase that value. Explicit subsidy was included in the governor's budget, but unfortunately it was a little lower than we had anticipated, so we do have work to do in this legislative session. We're also working at a federal level to ensure that the federal prescription drug subsidies are extended to government self-insured plans in Washington state. These plans resemble traditional Medicare, and we are also working to extend traditional Medicare to include not only vision benefits, but also hearing and dental benefits. We invite you to join our efforts, and I'm very happy to put contact information in chat. Thank you. Jeff?
Great. Thank you all very much. It's great to visit you all. Great organization. Look, traditional public Medicare is facing an existential crisis. There's literally a gold rush going on right now with private insurance companies, private equity firms, and Wall Street firms purchasing healthcare organizations to administer Medicare claims. Why are they doing this? In part because the Centers for Medicare and Medicaid Services allows generous payments sanctioned to these private firms. Anywhere from 15 to 30% of every Medicare dollar goes to profit and overheads of these private organizations. And just to give you an idea of the scope, right now, Medicare expenditures on an annual basis are over $1 trillion. So if you think about pocketing 30% of $1 trillion, you get the idea of why these private companies are trying to take over Medicare. The second thing that has been uncovered over the last several years in particular is that there is rampant, unchecked fraud by these private insurance and private firms that administer Medicare claims to the tune of tens of millions of dollars every single year. So PSARA, Puget Sound Advocates for Retirement Action, this 2024 will be our third year of a campaign to stop the privatization of Medicare. Last year, or this year, 2023, was the first time in history that there are more Medicare beneficiaries on these private plans than there are on traditional public Medicare. So what's at stake? Why is this important? Well, for a couple of reasons. Under traditional Medicare, our seniors' medical decisions are made between them and their doctors. If they decide that specialty care is needed, you get to do that, and you get to do it anywhere in the country. You control your medical decisions. You get to see anyone or any specialist without prior approval. Also, control over how Medicare trust fund dollars are used, the trust fund that you and I put into throughout our working lives, that's at stake. And most importantly, maybe for the Healthcare as a Human Right Coalition, is that Medicare for all is at stake. You know, you can get a Medicare for all system in a privatized system, but I don't want to see it. We need a public Medicare for all system. And if the private insurance industry and private equity firms continue to take over the healthcare industry and Medicare, that's all we'll get. We'll get a privatized healthcare for all system at some point, but it won't be what you and I think of. So PSARA's campaign in 2024 is pretty simple. We want to level the playing field between traditional public Medicare and Medicare Advantage programs and what are called ACO REACH programs. We want traditional Medicare beneficiaries to either have no or low monthly premiums. We want to eliminate the 20% Medigap charge that currently exists. We want a cap on out-of-pocket expenditures, and we want to extend the same benefits that Medicare Advantage recipients get to traditional Medicare, like vision, dental, hearing, transportation benefits, and the like. We believe that if you level the playing field between the private sector and the public sector, that more seniors are going to choose public traditional Medicare. And if they do that, then we have a chance to actually finally achieve a public Medicare for All program. I'll stop there. Thank you so much.
Thank you so much for those presentations. They were wonderful. Communications are the heart and soul of our work. We'll now get an update on how HCHR is working to improve our communications from Lauren German, who is a prolific organizer and fundraiser at Washington Can.
I'm going to go through our new Healthcare as a Human Right website. So this is the homepage. It includes the policy agenda and the activist toolkit, which is just like helpful resources to be reminded of, such as the healthcare committees, how to support oppose a bill, things like that. And then the About page has the most information on it here. It just says, you know, what HCHR is, as well as all of our principles listed out here. And then just a note on accessibility. If you are scrolling in your own time on the website and notice anything that you would like to be made more accessible, please send me an email. I'll throw that in the chat after I'm done here. And then so we have our committees. We have the addition of HUC's committee with a description. Thank you for Mo and John for working on that to get me that. And then this probably is my favorite portion. Here we have all of the sponsor organizations and ally organizations. And this will actually, if you click on any of the organization's logos, it'll take you to their website and or Facebook. If you are noticing that you would prefer to have a Facebook versus a website with compared to what is on there, again, send me an email and I'll be happy to adjust that for you. I don't know if you guys could see the other tab, but then I have the same thing down here for our allied orgs, our policy agenda, our leadership, and the healthcare as a human right history that has highlights since 2017 up until present day. And then on our Get Involved tab is just a way for folks to get deeper integrated into the work. So you can subscribe to the newsletter. Organizations can fill out a form if they're interested in joining the coalition. And you can also share your healthcare story here. And then we have the events tab. Here's the general meeting today. We have Washington Can and American Federation of Teachers Lobby Days on here. If you guys have events that you would like to be featured on this website and also on our social media as that develops, please, again, send Nathan or myself an email. That would be awesome. I'd love to highlight those things for you guys. And then lastly, the newsletters tab. So you can sign up for the newsletter directly through this form, view all of the 2023 newsletters, and there is also an archive to view all of the past newsletters.
That's 1 minute, Lauren.
Perfect. Well, I am done. How do I get out of this? Stop share. Any questions? Yes, so very excited about the new website, and then I'll be working on starting again to develop more of a social media presence for HCHR. And yeah.
Hey, thank you so much. Wow, that is one amazing website. I can't wait to get some time on my hands to go over it. Now we will get a brief report from our budget committee and its 3 members, Tracey Murphy, Jesus Sanchez, and Carlos de la Torre. Let's see, Tracey helped form the committee and wisely persuaded us last year to get our horse in front of our cart, waiting to initiate a dues policy until we had a budget proposal as well. Jesus is CMAR Vice President for Operations and a member of our HCHR Steering Committee. Carlos is an executive board member of Puget Sound Advocates for Retirement Action and a retired State Labor Council accountant. So take it away, Tracey.
Good evening, everyone. It's good to see everybody. We'd like to thank all of our member organizations that have provided many generous donations, including a few that went well above our expectations. We are glad to report that we raised more than our goal amount of $12,000 and that we spent less than what we had budgeted for. This is primarily due to some changes within the leadership of our communications committee. We've been regrouping on comms and are pleased to report that some of our anticipated needs, such as consulting and website development, are now being solved through staff support from Washington CAN. And you just saw a great example of what they did. We're excited to continue building our coalition's work in 2024 to achieve our goal of universal, equitable, and affordable health care for everyone in our state and nation. We know this means generating grassroots power to overcome the outsized political influence of the medical industry complex. This will require strengthening our budget in 2024. We thank our member organizations in advance for continuing to honor the organizational membership dues policy that we adopted this time last year. This policy calls for sponsoring voting member organizations to remain in good standing, to donate annually on a sliding scale, or to contribute in kind if even modest dues are a barrier. Late dues donations are coming in, and we expect our cash on hand balance at the end of this year to be approximately $18,000. We want to mention that the 2024 dues donation should be received by the due date of March 31st of 2024. If you have any questions, please email HCHR Steering Committee Co-Chair Nathan Rodke at nathanrodke@washingtoncan.org. Thank you so much for your support and all that you do to advance the cause of healthcare justice. Jesus, did you want to say something?
No, I think Tracey you did a really great job. I think the fundamental piece for us is planning, right? Strategic planning and careful approach to and delivery process that we take with respect to how we spend and pursue our goals and our objectives through our budget. And part of that is the reason for March 31st is that it allows us to really carefully, if we have our budget intact by the 31st of March, we're able to truly plan out exactly how much we can spend for the balance of the year. So it's very important to always be ready and understand that if we have the funds in the bank by the 31st, it allows us much more even, clear planning and deliberation and follow through on the plans that we have for communication. So I want to thank everybody. It's an amazing thing to see this happen and to establish a budget that's getting stronger. And as always, like every nonprofit, no different than us, we are always, we're never going to have enough, but we're always going to have support. And that kind of support is so important for all of us, collectively and individually. personally, for me, is again, as I say, we've been through many organizations in my many years. I'm old as dirt, so I can say for plus 40 years. But I've seen it happen and amazing things that can happen even with just a few number of dollars. But your support is absolutely monumental. So thank you all very much for that support.
Thank you so much, Tracey and Jesus. We have a wonderful, wonderful budget team. Thank you. One of our strengths as a coalition is the great work of our policy committee. Here to walk us through our proposed 2024 policy agenda are the committee co-chairs, Hawa Elias, Public Policy Analyst with Community Health Network of Washington, and Emily Brice, Deputy Director of Northwest Health Law Advocates. They're also members of our steering committee and great ladies. Take it away.
Hi, everyone. Good evening. As Gina said, my name is Hawa, and I'm co-chairing the policy committee with Emily. Legislative session is starting, and we definitely felt that today when the governor's budget dropped at 1 o'clock. So things are starting up. And with that, we're happy to present our 2024 policy agenda. Next slide, please. There you go. I will drop a link in the chat for folks if you would like to follow along. Oh, thanks, Emily, for on it. You can access that document. It's our policy agenda, and we'll talk through it. Our policy agenda is centered on our 4 goals, which as a policy committee, we decided to keep the same as last year. And we've used it as a guiding criteria as we consider items for our policy platform. And in a minute, we'll talk about how each of the items on our platform fits with one of these goals. The first goal you see here is achieving universal healthcare in Washington State and in our nation. And that is the North Star. That's like the ideal goal. Goal 2 is to improve healthcare affordability and access. Goal 3 is advancing equity and addressing social determinants of health. And then goal 4 is defending access to healthcare through existing programs. You can read through more of the details, but these are essentially steps that we would need to take to ideally achieve our North Star. Next slide, please. So our policy platform was developed over the last, this fall, the last 2 months, and we had organizations bring forth their policy priorities that would align with HCR. So each bill or budget item went through our filtering process. And that's also something that we kept the same from last year. And the filter asked these questions. So one being, does the issue enhance and support the mission and goals of HCR? Does the issue have a critical mass of advocates, including a core leadership of organizations within HCR? And is there a clear and realistic strategy to pass or adopt this policy proposal? I will put the link. Oh, Emily's on that again. The link is in the chat if you'd like to see what that filtering document looks like and how it was filled out. It also includes bill numbers for the items that we're putting on our agenda. So now we'll go through each goal and discuss the state and federal policy proposals, and then also some non-legislative items that supports that goal. Not everything, it's not all encompassing of everything that's on our platform, and some things might fit under multiple goals, so keep that in mind. And we also recognize that there are new bills that will be introduced every day during session, so we'll have a process to refine that with our steering and policy committees. So the first goal is achieving universal healthcare in Washington State and our nation. Things that we're seeing for this next session is on the state level, advancing immigrant health equity, as our presenters talked about earlier, expanding and asking for more funds to expand the immigrant coverage programs will be important, and then also supporting other legislative efforts that would expand universal health care. So for example, the continuous coverage for kids 0 to 6 in the CHIP program, which is the Children's Health Insurance Program. And so both of these items would expand access and coverage for more individuals in our state. On the federal level, we are supporting congressional efforts to expand universal health care. So the Medicare for All Act is a great example. And also expanding other legislation that would allow our states to have more authority over a state-based universal coverage system. So that's the State-Based Universal Health Care Act. Outside of the legislative world, pursuing universal coverage through the Washington Universal Healthcare Commission will still be important and something that we'll continue to engage in.
Thanks, Gina, and thanks, Hawa. Okay, I'm going to take over on the next slide, and I want to say it's been such a pleasure working with Hawa this year. I'm Emily Brice. I also want to say I'm going to try to pick up a little bit of time here because we're behind. So I'm going to speak quickly and appreciate Gina's mention of the questions. And also am always willing and happy to talk to anybody who has questions about this at a later time. Okay, so our second goal recognizes that a major part of working towards a universal healthcare system is getting a handle on the profiteering culture that has grabbed a hold of our healthcare system. And we heard a little bit about that today from Jeff and Lori. And so we prioritize working on policies that can improve healthcare affordability now and access for people now, while also working on the root causes of what is driving those challenges, such as lack of accountability, and I'm just going to say it, greed. So some of the pieces that we have proposed for the platform this year are a couple carry forward items in this area, given that we're in the second year of the biennial session. So first we have ensuring state oversight of healthcare entity spending, and that's that Healthcare Cost Transparency Board bill that was proposed last year, House Bill 1508. That would make sure that our state's new Healthcare Cost Transparency Board actually has the authority to get to the bottom of what's driving spending in excess of the goals that our state has set and hold actors accountable when they exceed that. The second item is to address outsized bargaining power of the consolidated health entities that unfortunately we have in the landscape. And here is an example. We have our Fair Hospital Contracting Bill, Senate Bill 5393, which is also a carry forward. Now, Sarah mentioned that we can't unwind the consolidation that has already occurred. And that is unfortunately true in many ways. But we can make sure that there are guardrails so that when there are giant healthcare corporations that are making decisions about the prices they want to charge us and other behavior, that there's some guardrails on how they are interacting in our healthcare market. New to the agenda this year, we propose to add an item on banning abusive healthcare billing practices. And we've actually had versions of this in the past related to balance billing, you know, that egregious practice where you think that you're covered for a service and then you get balance billed for charges that are kind of unexpected. And there's a bill that the insurance commissioner is going to be helping to put forward this year related to fixing a remaining loophole in that area, ground ambulance balance billing. And I know all of us know somebody who's had that ambulance ride and then gotten the very unexpected bill afterwards. So propose to work on that together. And then at a federal level, we have a new item again, focused on supporting targeted efforts to build healthcare workforce to address the access shortages, unfortunately, that we have. And that's adding to the kind of good parts of our healthcare landscape, providers that are really focused on meeting our access challenges. And here we have a proposal that came forward around Bipartisan Primary Care and Healthcare Workforce Act. That's Senate Bill 2840. And I should mention that parts of this bill, it looks like they're being carried forward in another vehicle, the Lower Cost, More Transparency bill that just passed the House at a federal level this week. So we'll be monitoring this item and seeing how it plays out. But excited to see some potential federal investments in the parts of our healthcare workforce that really are needed to address access shortages. Finally, non-legislative items, we are focused on making sure that we keep a finger on the pulse of the state's Healthcare Cost Transparency Board, Prescription Drug Affordability Board, and the exchanges, Cascade Care Public Option, all of which have been part of our kind of platforms and thinking in the past. Okay. Next slide, please. So goal 3, equity and social determinants, recognizes that our current healthcare system is riddled with inequity and disparities. So we can't just raise all boats equally in our quest for a universal system. We have to make targeted efforts to improve the disparities that exist today. Here, we've already talked about some of the items that are on the proposed platform. So first item at a state level is the Keep Our Care Act, and Sarah spoke to this, a really powerful tool to ensure that community needs are considered when there are shifts in our healthcare delivery system. New this year, the next item is, again, supporting some of those workforce pieces and disparities that we see as a result of that. And here we have a proposal coming forward from member NAMI Washington around prescribing psychologists and taking some really targeted steps to address the severe behavioral health crisis that we have by allowing psychologists to step in with prescriptions in those shortage situations where many parts of our state don't even have a psychiatrist available. And that's particularly true for Medicaid. On a federal level, and I do apologize for speaking so quickly about these important policies. On a federal level, we heard earlier about efforts to expand healthcare to immigrants on a state level, but there are also efforts at a federal level, and we've been supportive in the past, and this is a carry forward of trying to remove those federal eligibility restrictions that got us into this mess in the first place. And Representative Jayapal has been really powerful in her Lift the Bar Act and related proposals that would try to ensure that there aren't these disparities in the first place in federal law. On a non-legislative level, we want to and have been working really hard in our organization to support and increase leadership presence and opportunities for communities of color in all of our healthcare governance opportunities. And that's something that we want to continue to put front and center. Next slide, please. And this last one is defending public programs. And our goal here, remember, with goal 4, we recognize that we can't make forward progress if we're sliding back and we're fighting a culture of austerity all the time, right? That's not going to work. So here, on a state level, we propose to continue, and this is carry forward, continue to support the progressive revenue we need to invest in public programs, right? Fighting against that culture of austerity. A prime example here is the wealth tax, which has been proposed in the past, but this is, of course, that 1% tax on financial assets above $250 million. I don't even know anyone who would be hit by that. And it really only would impact about 700 of the wealthiest Washingtonians and could raise an estimated $3 billion a year. So what could we do with $3 billion? We could transform our healthcare system, among other good causes. Second item is at a state level is around kind of preserving the existing coverage gains we have. And a prime example of that is we have seen a tax this year, unfortunately, and in the past on the ACA's preventive services requirements, you know, the pieces of the Affordable Care Act that allow us to get those annual preventive services, contraception and other pieces without cost sharing, colonoscopies, et cetera. And unfortunately, there have been continued federal attacks on that. There's litigation that could challenge some of those pieces at a federal level. So House Chair Riccelli is planning to repropose a bill that would put some of those pieces in state law to protect us here. And I'm going to get the chime soon. So I'm really talking fast now. At a federal level, in terms of defense, we talked earlier about leveling the playing field with Medicare Advantage and defending original Medicare as kind of our true North Star. And we heard about that really powerfully from Lori and Jeff, including some of the benefits and enrollee expense differences in some of those programs. So thanks for sharing that. And on a non-legislative level, we propose to not forget about the roughly 500,000 Washingtonians who've been terminated from Apple Health Medicaid this year as a result of the public health emergency winding down and changes to coverage. And there's more to come. So we need to continue to keep an eye on that because those eligibility changes are affecting people and there will be a long tail to that. So those are the again policies that we hope to bring forward today and are bringing forward for your consideration. As Hawa mentioned, those are there are some examples included in our discussion today, but we have a process to consider additional things that come online later. And if we go to the next slide, I want to very briefly mention that we typically set this process on an annual basis, and we've done that for many years. One of the things we've been working on a bit with the steering committee this summer and fall is in thinking about setting a longer term vision for us in HCR in our policy agenda, and thinking about a 3-year vision that we could consider that would have us ask ourselves the question, if we're successful at taking these targeted actions within the next 3 years, we will have achieved major progress in the following ways. And that can be a way for us to kind of measure our progress over time, right? So we're not just introducing targeted proposals each year, but we're also seeing, are we getting closer to our North Stars? Are we getting closer to where we want to see ourselves over time? So that's a process that you can expect to hear about more at the spring general meeting, but wanted to just kind of put it out there as an ongoing project that we're working on in the policy committee and the steering committee. Okay, so if we go to the next slide, please. I think we're at questions. We're only a little bit behind, so we'll take a couple questions if anybody.
Emily, before we start discussion, do we have a motion?
Yes, thank you, Jim. I will make a motion to adopt this policy agenda.
I will second that motion.
Second.
Okay. And then we'll hold it open for discussion and questions, and then we'll be ready to vote shortly.
I don't see any questions in the chat, but feel free to raise your hand or unmute if you have any questions.
Okay, we're getting some love in the chat. Thank you. We also take critical remarks and feedback. Okay, so we'll say going once, going twice, and Hawa and I will both put our email addresses in the chat in case people have questions or want to dig into some of these details. Thank you, Mohammed. Appreciate that. Right back at you. Okay, so then I think thanks for listening to all that and your feedback, and I think we'll hand it over.
Thank you for those presentations. They were so wonderful and very interesting to listen to. I raise my hands to you. And now we get to our main task tonight, voting on our 2024 policy agenda. Conducting the vote will be Jim Howe, board member of American Federation of Teachers, Washington Retirees Chapter, and member of our steering committee. Jim will fill us in on voting with confirmation of a quorum. Go ahead, Jim.
Thank you, Cheryl. We have tonight we have 36 voting organizations, which is more than the 2/3 quorum of 25. We will be voting on the policy agenda motion, which has been seconded and discussed. When called, you can vote yes, abstain partially, no, or fully abstain as shown in these examples on the screen. A partial abstention means your organization cannot support an individual item or two. Your exception will be noted in the recording, but will be counted as a yes for passage of the resolution, which needs 50% plus to pass or 19 votes. I will call the sponsoring organizations alphabetically, so the designated voters should unmute before their turn, and please mute once your vote is confirmed. Once all votes are called, counters Margaret Carey and Kelly Powers and I will briefly confer and announce the results. Is any question on that? I think it's the same policy we followed last year. So I'm going to start the roll call alphabetically with the American Federation of Teachers, and I happen to be the designated voter for that, and AFT votes yes. I'm looking for the voter for the Asian Pacific American Labor Alliance, Amy. Is Amy Leong? She votes yes. The Asian Counseling and Referral Service, Michael Bayan.
ACRS votes yes.
Thank you. The Backbone Campaign, David McClanahan.
Backbone Campaign votes yes.
The Carolyn Downs and Country Doctor Community Health Centers, Michael Craig.
CDCHC votes yes.
The Coalition of Black Trade Unionists of Puget Sound, Claude Burfict.
Coalition of Black Trade Unionists vote yes.
The Children's Alliance, Max Lau.
The Children's Alliance votes yes.
The Community Health Network of Washington, Hawa Elias.
The Community Health Network of Washington votes yes.
The Economic Opportunity Institute, Tracey Underwood.
The Economic Opportunity Institute votes yes.
The Faith Action Network, Kristen Ang.
Faith Action Network votes yes.
The Healthcare for All Washington, Ronnie Shore. Ronnie, are you unmuted?
Yes, I was trying to do two things at the same time, but Healthcare for All Washington votes yes.
Lilo, the Legacy of Equality, Leadership, and Organizing, Amy Leong. Amy, you can vote for both organizations. And Amy votes yes. The League of Women Voters Washington, Mary Lynn Courtney.
The League of Women Voters of Washington votes yes.
The Machinist District 751 Retirement Club, Tom Lux.
The Retirement Club votes yes.
The NAACP Seattle King County, again, Claude Burfict is voting.
The NAACP votes yes.
The National Organization of Women of Washington State, Cheryl Wapesamaze.
The National Organization for Women, Washington State Chapter votes yes.
The North Seattle Progressives, Mo Brinkland.
North Seattle Progressives votes yes.
The Northwest Health Law Advocates, Emily Brice.
Northwest Health Law Advocates votes yes.
The Pacific Islander Health Board, Lika Smith.
The Pacific Islander Health Board votes yes.
The Physicians for a National Health Program, Washington, David McClanahan.
Physicians for a National Health Program, Washington, votes yes.
Pride at Work of the AFL-CIO, Mike Andrew.
Pride at Work votes yes.
Pro-Choice Washington, Sarah Dixit.
Pro-Choice Washington votes yes.
The Puget Sound Advocates for Retirement Action, David Loud.
PSARA votes yes.
Real Change News, Camille Gix.
Real Change votes yes.
The Retired Public Employees Council of Washington, Gwen Wrench.
The Retired Public Employees Council of Washington votes yes.
Save Secular Healthcare Washington, Dennis Barnes.
Save Secular Healthcare votes yes.
CMAR Community Health Centers, Jesus Sanchez.
Our community health centers vote yes.
Seattle Indivisible, Paul Oldenkamp.
Seattle Indivisible votes yes.
The Somali Health Board, Mohammed Shadain.
The Somali Health Board votes yes.
UAW Local 4121, Natalie Wellen.
UAW Local 4121 votes yes.
The Washington Community Action Network, Nathan Rodke.
Washington can emphatically votes yes.
The Washington Federation of State Employees, Cindy Hall.
Washington Federation of State Employees votes yes.
The Washington State Labor Council, AFL-CIO, Sybill has given her proxy to Claude Burfict.
Claude, please unmute. Claude, Claude, please unmute.
As a proxy voter for the Washington State Labor Council, the Washington State Labor Council will abstain on federal state-based universal coverage bill, but otherwise everything else is okay.
Watch for me.
Okay, we'll count that as a partial abstain.
Yes.
The Washington Working Families Party, Vanessa Clifford.
Yes.
The Washington Poor People's Campaign, Ming Chen.
Sorry, Ming, you might, I muted you because we weren't ready for you yet. Please unmute.
Washington Poor People's Campaign votes yes.
And the Washington State Alliance for Retired Americans, Jackie Boscia.
Washington State Alliance for Retired Americans vote yes, but abstains on all the federal legislation.
Okay, thank you. And thank you for making it easy. Give us a few minutes while I confer with my fellow counters, and we'll be right back.
Go ahead. Thank you, Jim.
I would like to announce the results and congratulate this organization and especially the policy committee for the hard work they did on this. We have, of the 36 voting members present today, we have 36 yeses, and 2 of those yeses are partial with abstentions on specific issues. So the measure passes practically unanimously.
All right. Well, let's hear it. Thank you, everyone.
Gracias, everyone. That's
We're
fantastic.
celebrating. Yeah, let's all right, I'll stop.
Yay, now we go on, right? We'll get a call to action by John Godfrey, Washington CAN lead community organizer, Hicker steering committee member, and co-chair of our organizing committee. He's just an all-around great guy. Go ahead, John.
Thank you so much, Gina. I'll keep it short and simple today. We are ahead of the game in our direct action, our virtual direct action in support of the Keep Our Care Act. Sarah gave a fantastic introduction to the bill earlier, and I just want to emphasize something we have heard repeatedly from Tracey, from Tom, from so many of us, is the power of the hospital systems is immense, and we are the bulwark for patients and families against the medical industrial complex. From our many voices, there's but one chorus. We stand united against profiteering in our healthcare and in demanding greater accountability and oversight of our health system mergers in our state. Please follow the Every Action link that I've posted in the chat now. It will take you to a very short form that you can fill out, and then it will automatically generate a message to your state senator, because as Sarah mentioned, the bill will be starting in Senate Rules Committee when the session starts on January 8th. If anyone has any trouble filling out that form, please just shoot me an email. That's johngodfrey@washingtoncan.org. I will give folks a minute to fill that out before we close for the night.
Okay, thanks, John. That was really great. And thank you for all of the hard work that you do on the steering and organizing committees. So this brings us to the good of the order, and we have a hard stop at 6:30. We are running a little late, so let's say about 6:42. So if you have lobby days to announce, Please make it quick, and lobby days will be in our next newsletter. Cello Echeverria, John Godfrey, and Jim Howe will now speak on their lobby days. Thank you.
Let's go ahead with John, and then Jim, and then Sarah Dixit, and then Claude.
All right, everyone. Again, keeping it quick. Washington Can's Lobby Day is going to be on Martin Luther King Jr. Day. That is Monday, January 15th. And then we're going to be starting off we're going to be based at the Washington State Labor Council down there right next to the Capitol.
American Federation of Teachers Washington will have their lobby day, as we do every year, on President's Day, February 19th. The link to sign up for that will be in the newsletter. And this year, as we've done in the past, we've really allied with the community for our colleges, and those students are just great, and they're having their lobby day on January 15th. And the other team we've done is because our policy committee wanted to address gun violence on campus as a workplace issue, we've allied with the Alliance for Gun Responsibility, and they're part of our lobbying team. So big day on President's Day.
Our Pro-Choice Washington Lobby Day is on Tuesday, January 16th. So the registration link is going in the chat. So yeah, please join us.
RPEC, Retired Public Employees Council Lobby Day is on January 22nd. And I know Lori Wiedner is still available. She can put all of that information in the chat. And we hope to see, we have a lot of issues. And we hope to see a lot of folks there for our lobby day. Thank you. And I also want to mention that on January 15th, the Martin Luther King Coalition, which I'm on the board of, is having an annual march regarding Dr. King's birthday that we are celebrating, and we have a marching rally. Plus, I'm putting together a trade event that day. We will have several trade organizations there, and I'm working through one of the organizations that the city has put together. So if you can be there and bring some of the young folks who may be interested in the trades, we will have it from the electrical to the plumbers, to the maritimes, you name it, and try to get some of these young folks involved in the trades. And these are livable wage jobs. So please be there.
Thank you so much, Claude. I wanted to also just really take a moment to recognize everyone for showing up and really just demonstrating a lot of solidarity on all of our shared goals by showing up tonight and affirming that once again for the upcoming year. We really appreciate all of you. And also, just in case, I realized I didn't introduce myself at the beginning. I'm Nathan Rodke. I'm the co-chair of the Healthcare Human Rights Steering Committee, and I work with Washington Can, but I didn't introduce myself at the beginning. So there's that as well. But I really appreciate all of you, and I'm going to hand it back to Gina and Cheryl.
Well, I guess that means we close out, Cheryl. How do you think we did?
I think we did great. I'm really, really pleased with this meeting. And I really want to thank Nathan and David for all the hard work they do and everyone else that was involved in this. And I really want to thank the people who presented and the people who showed up.
Yes.
So I raise my hand to all of you.
And we cannot go without thanking Emily and Hawa for all of the hard work they did on the policy proposal. Thank you too, and thank you all the presenters. Good night, everybody. Have a great evening. It was nice. Bye.
Good night.